A recent report ranks Texas the second worst state in the country for women's reproductive health. Among people of reproductive age, Texas also has one of the highest rates of being uninsured. Here to discuss more with us, we have Teresa Morris. She's the Director of Women's and Gender Studies program at Texas A&M University. Thank you so much for being with us today.
No, thank you for focusing on this story.
Let's start with this. The lack of insurance. It is leading people to not seek reproductive care because it is so expensive. So why is reproductive care so expensive?
Right. Well, it's expensive in terms of not having insurance. We know that Texas has the highest rate of women being uninsured in reproductive age, which is defined as 15 to 44. That's certainly because of Medicaid not being expanded in Texas. And just briefly, what that means is when we didn't expand Medicaid access in Texas, it means that among the 10 other states that didn't, that if we expanded it, adults who make up to 138% of the poverty level could be covered on Medicaid. But for our state, we don't have that. So I don't know that the cost of reproductive health care is that expensive compared to other things. It's just that we have such a large proportion of women in that age who aren't insured in Texas.
Are other states affected by this as well, the lack of expansion of Medicaid?
Sure. There are 10 states that didn't expand Medicaid, but what we see is that Texas has the strictest requirements to be on Medicaid. And in fact, working adults don't qualify to be on Medicaid unless they're caregivers, disabled, pregnant, or over 65. So that leaves that large proportion. And then the Affordable Care Act does have subsidized insurance, but one has to make 100% of the poverty level to enter that exchange. So it's called a gap, and there are about, I think, 800,000 people in Texas who are in this gap where they don't have employer-sponsored health care, they don't qualify for Medicaid, and they can't enter the exchange. And a lot of those women are, a lot of people who don't qualify are women of that age.
That's a big number.
It really is.
One of the things that Texas did better with, according to the report, was mortality rates. Texas was among the top 15 states for women between ages 15 to 44. So why is that number better, but others, you know, Texas didn't do so well in this report?
Yeah, well, so we know that the insurance issue and women not seeking care because they don't have enough money, right, putting off care, that's Medicaid expansion. Like, we can directly see that. But Texas has put resources into addressing maternal mortality and infant mortality, and particularly for maternal mortality. There's a maternal mortality and review board that does biennial reviews, and we're a state that did form that committee. And so that, I think, is why you're seeing those numbers a little bit better. And they, you know, there are over 40 measures on this report card, and Texas didn't do poorly in all of them. Yeah. Texas did poorly in some of them, but some of them they did really well, and infant mortality as well.
Texas is seeing lower numbers for health provider accessibility, including midwives and doctors. Can you explain why that might be?
Yeah, and so there is some research that suggests that states that have abortion bans have fewer doctors, and so that's a policy we know might be going into that. We're also a really big state that's very diverse, and so we have what we call maternity care deserts in a lot of West Texas. So those are counties that don't have any obstetrical providers, and they also don't have a hospital or a birth center that has obstetrical services.
I got about a minute left here, and you study, obviously, health for women. Where do you feel Texas could improve for the future? Are there some tangible and attainable steps that can be taken immediately to help improve this, you know, Texas on this list?
Yeah, well, we could expand Medicaid, and actually there's survey data out there that suggests that the majority of Texans actually support that. So that could be a priority of people as you think about, you know, kind of who to vote for, or issues that you might support and write to your congressperson about. That would deal with that. And I also think support community birth and home birth midwives. That's a place where the maternity deserts are served. So these are midwives, certified professional midwives, who are all over Texas and serving many of those deserts, and we even have some in our community. And we are lucky we have a birth center, a Jubilee Birth Center in our community. So we think focusing on supporting community birth, and also, you know, focusing on how do we expand healthcare access for those who don't have healthcare.
Very good. Teresa Morris, Director of the Women's and Gender Studies program at Texas A&M. Thank you so much for your time today.
Thank you.
Okay, we're going to take a live eye look outside. Berkeley is going to be back with a look at your forecast right after